Good afternoon and warm welcome. I'm Hitesh Vaidya, Director, National Institute of Urban Affairs. Welcome and thanks for joining us to the launch of this report titled Children and Adolescents in Urban India, Scale and Nature of Deprivation. This study is an outcome of joint collaboration between UNICEF and NIUA, and the broad objective of the study is to mainstream needs and concerns of children and adolescents in the policy and planning discourse. As we all are aware that childhood and adolescence is a significant phase of development throughout the lifespan of an individual, and it forms the basis for later life outcomes. And we all have lived through this phase, so I think all of us understand it much better. The success of these findings of this study, which we will be sharing very soon with you, actually will depend on how this report really contributes to the ongoing policy discourse on more inclusive and evidence-based planning. And I hope this will be a useful resource to all the planning practitioners and guide them towards introducing new approaches and skills to mainstream inclusiveness in the whole planning process. I, on behalf of NIUA and UNICEF also, because I was the earlier part of the UN family, I take this opportunity to welcome all the eminent speakers, panelists, and all distinguished guests and friends who have joined us today. We are really fortunate to have Shri Kunal Kumarji, Joint Secretary and Mission Director, Smart Cities from the Ministry of Housing Affairs, Dr. Yasmin Ali Haq, UNICEF Country Representative, and my colleague in UNICEF, UN Habitat earlier. Thanks, ma'am, for joining. Shri S.V. Ramna Murthy, Additional Director General from Ministry of Statistics and Program Implementation, Professor K.S. James, Director, International Institute of Population Studies, Mumbai, and Professor Ravi S. Srivastava, Director, Center for Employment Studies from Institute of Human Development, New Delhi, Professor R.B. Bhagat, Head Department of Migration and Urban Studies, International Institute for Population Sciences, Mumbai, and Mr. K.D. Maiti, Planning, Monitoring and Evaluation Specialist from UNICEF. Thanks all of you for joining us and sparing your valuable time to discuss the findings of this study. I would once again like to welcome all the participants who are there with us in this evening. And I also request, because we have a short time, there is a lot of discussions on this finding. I immediately hand over this to Debolina Kundu, who is the lead author of this research, to take it forward. And I hope the discussion during this deliberations during this 1.5 hours will really contribute towards the dialogue of inclusiveness, which we are seeing post-COVID quite a lot. So with that, over to you, Professor Debolina Kundu.
Now, without wasting much time, let me invite Ms. Yasmin Ali Haq from the UNICEF. She is the UNICEF representative in India. Ma'am, I would request you to introduce the study and set the context. You need to unmute yourself.
Myself first, yes. Thank you so much, Debolina, and really good to reconnect, Hitesh. And greetings to all the panelists that we have here today. Many children and adolescents living in cities and in peri-urban areas are witness to the challenges of survival, development, and growth. Even though cities, town, and its outgrowths provide a lot of advantage that urban life has to offer, like health facilities not being too far away, like education facilities being available, spaces for recreation, and especially if we compare it to children who live in rural areas. And across the globe, the majority of families and children living in these families do face inequity when it comes to enjoying the basic services. And that for us is really the right to quality education, to comprehensive healthcare, water, basic services, and protection from violence, abuse, and exploitation. And in fact, we know that children in many of the vulnerable urban areas are facing multidimensional deprivation. So when it comes to this agenda, a very important part is as part of when we talk about the Sustainable Development Goals and the agenda of leaving no one behind, it's really important that we focus our attention on communities in cities. We know that the government is reflecting on a comprehensive policy, having an integrated urban policy too, where development partners, CSOs have a role to really highlight the vulnerable situation of families living in these communities. And I especially refer to those who are living in slums in the periphery of the megacities and outgrowths. Now, we know that the COVID pandemic, which is causing catastrophic adverse effects in the life of people across the world, is especially affecting in India our people in urban habitations. It is clearly shown the cracks in the system, and it is really showing us how not prepared or ill-prepared we are for such shocks. Those who live in the peripheries are generally, we call them urban poor, and we know that they're largely constituted of migrant families and families with little or no amenities of living with dignity. In this background, and for us as UNICEF, when we want to be looking at who are the children who are not being reached, really this initiative that we've taken on with the National Institute of Urban Affairs to assess the gaps so that we can look at what policy interventions are needed, and that it be based on the evidence from existing data so that we can at least bridge the policy and the program gaps also. Lessons from COVID point to the fact that social protection for migrant workers, especially in urban slums, needs a much sharper focus in urban governance. And there is thinking to introduce social protection measures in local urban bodies to reduce aftershocks of pandemics and humanitarian disasters in a manner that is predictable and is institutionalized. The policy framework, definitely we're seeing again and again, needs to include livelihood, the basic services, and especially for seasonal migrants and the homeless population, besides addressing the issues of formalizing employment contracts, we also need to be looking at housing spaces for children and their families. Now, from the 2011 census, we know that India is home to over 13.5 million households living in slums, of which nearly 4 million households are in the informal or the unnotified slums. And there the challenges are probably the greatest. And that's where there is need for an integrated policy and predictable schemes that might at times even require the schemes from one state to another to be portable, so that no matter where people live or move, they are covered by the schemes, the social protection schemes. So we know that globally slums really are embodied by spaces that have little space for living, for recreation, for sport. And what we do need for children's optimal growth is that space. So it's very important that how we look at urban development, that it takes into account these issues is also taken into consideration. It's not just about building schools, colleges, and hospitals. It's important to look at the living spaces and the space for children to safely play in their communities. The Convention on the Rights of the Child has set out that it must be realized for children to develop their full potential, free from hunger and want, neglect and abuse. When children live with their parents, with their relatives, it's not just the children in isolation. We need to be looking at their families as a whole. More and more, we need to be looking at the risks that young people and adolescents are facing, especially in urban areas. So how we get their voice to be brought to the forefront, to be brought to the notice of the decision makers is very important. And for that, it's been critical for us to look into getting the evidence and the data. And look at what the vulnerabilities are. And I'm really excited that today we will be looking into the findings of this study. And it will remain a study on a shelf if we don't take these learnings and A, find out where are knowledge gaps that need to be addressed, and B, really how can we bring this constructively to the attention of the policy and decision makers so that we don't leave children in urban areas behind as we move towards the SDGs. So with that, I thank you and really look forward to listening to the presentation and the discussions following it. Thank you. Back to you, Devalina.
Thank you, Yasmin ji. Thanks for introducing the study and setting the context and really highlighting that there are cracks in our urban peripheries and the slums where we really need to work hard to achieve the SDGs, and also in light of the COVID, I think we need to take concerted actions. May I now request Mr. Kunal Kumar, Joint Secretary, Ministry of Housing and Urban Affairs, Government of India, to deliver the keynote address.
Thank you, Professor, and very nice listening to you, Yasmin, and very warm welcome to everyone on the call for this, to bring out this report on the scale and nature of deprivation among children and adolescents in urban India, an empirical analysis. I would start by maybe reflecting on my the ways I have interacted with this topic over my career, working in the urban areas. So one of the things I recollect is, when I was serving as the municipal commissioner in Pune, we were doing an analysis of street children in Pune. We're trying to find out how many children live on the streets in Pune, live in street conditions. Doesn't mean that they actually live on the street as in their home is on the street, but most of the time they spend on the street. And we actually, went to every child, interviewed every child, and we found out, and to our surprise, about 14,000 children we found on the streets of Pune. And we found them to be from 3 different nationalities. We found them, in fact, some of them were 3rd generation families living on the streets. So, this is one aspect of urban development, or the way our urban areas are growing, that completely eludes us. Hadn't I done this, I would never have been able to get the kind of, insights we got from, and the thought process it actually ignited in our minds to how to look at this issue in the overall urban management, perspective. So we looked at bridge schools. We got about 40 different NGOs in the city to work with us. And then we created a bridge program of how to get these children from where they were into the mainstream of education and health. But it needed a bridge between, because you could not have taken from one scenario to the other, because emotional traumas and other things that go along with this kind of process actually repel them back into the scenario 1. So, and that was quite a learning. We worked out a public-private partnership with the Bajaj Group, and together we created a lot of facilities where street children started to get rehabilitated. So this one thing which comes to my mind as, the kind of complexity you can have. It's one thing to talk about this issue, but the kind of complexity you can have in actually dealing with this issue. The second recollection I have, and the reflection I want to make, is the divide that we see today during COVID as to the access to education. As it is, the access to education is a big issue. I'll again reflect from my times in Pune. From what I remember with the figures, I think 6 lakh children in Pune. Out of the total population, it comes to around 20%, 22%. And of course, the numbers will be more. This is the census number. And out of which, out of 10% of this number, which is 6 lakhs, 20% used to go to municipal schools. So around 1 lakh children used to go to municipal schools, which is 1/6, 17%. And our ability to give them good education was always under question. even though the salaries we paid to our teachers were one of the highest in the industry, much higher than very well to do good quality private schools, but the quality of education. So there is always this a problem with incentive structures and mechanisms through which we provide education. And this is not a small story about how you're providing education. By the way, these children need to be prepared for the knowledge economy. Tomorrow's world is going to be heavily driven by knowledge, and so it's not going to be the manufacturing world for a long time, wherein low skills can come in and actually make money through economic activity. You need to be well educated. So that's a cause of concern, and it's actually got fairly starkly brought into the open because of COVID, because we see a further collapse in the education mechanisms for low-income children, whereas others could get online education. And this is a bridge that we're now trying to build, but it's a bridge we're trying to build late for sure. And therefore, these things, again, never come to the mind of an urban planner, which is what urbanization needs to absorb. The third thing is about the way we look at this entire education. Of course, a new education policy has come in, but how do we actually look at entrepreneurial education, creating different avenues for children to learn to do a lot of things as they educate. So that's another thing where I think we need to come in. Of course, a large part of the discussion today is on health, and I think health, whether it be because of clean water and sanitation, it is because of reduction in hunger, or maybe gender equality, water, those things, of course, no doubt. And those things, by the way, I didn't start with those things because I think those things at least get talked about. At least are mainstreamed in the discussion on urban. Every discussion on urban will have talks on water, sanitation, Swachh, and this. But specific aspects on the different nuances of the problem don't get really talked about. For example, how important is activity in the life of children? Are they getting enough activity? These days there's a problem in while there is a problem of deprivation on one side, there's a problem of excess on the other side. And both of things are equally important for us. And as policymakers, we need to adopt strategies which mitigate both. So one of the things that we are looking at again as a mission now, very soon over the next 15 days, we are thinking of launching the infant toddler caregiver challenge. And we are now trying to infuse money into urban planning processes which take care of how cities look at infants, how cities look at toddlers, and how they look at caregivers, and how various aspects for improvement of public spaces, road infrastructure, a lot of different things about schools, nuances about even small, how footpath height should be there, how width should be there, what kind of walking facility should be there. All that is getting incorporated into the urban planning frameworks. So I think I would see most of what I will say is coming from the side of a practitioner who would like to take this agenda forward. So I am a consumer of the report as much as being part of NIUA in my role as the vice president. So I'm a consumer of the report, and I'm someone who's supposed to actuate this on ground. So I'm looking forward to hearing from all the best practices and all the good things that come out in this discussion, which can be taken forward in the Indian cities. I would request the NIUA team to really present to me whenever possible after this webinar list of items which can be quickly implemented in the city. So that's what the value I try to bring to this report by actually getting. So the proof of the pudding is in the eating. So let's use the pudding that you create to eat and create good solutions for the country going forward. So I'll stop here. Thank you so much. Wish you all the best.
Thank you, sir, for sharing your experiences as a practitioner, and also for this affirmative statement that you would like to take forward at least the low-hanging fruits, whatever has come out from our study. So we will positively get back to you on this. Now, may I invite our next speaker, Sri S.V. Ramanamurthy, who is the Additional Director General, Social Statistics Division, National Statistics Office, Ministry of Statistics, Government of India, to deliver the special address.
Good afternoon to all of you. At the outset, let me thank you for inviting me. And I congratulate NIUA and UNICEF and UPA for undertaking this study. So, I mean, the findings will certainly provide an insight on opportunities and facilities for children and adolescents in urban areas to develop a healthy lifestyle which is linked with the level of nutrition and standard of living. The stronger focus, I mean, I'll be more focusing from the side of SDGs, how we are, because we have this, as even Madam Yasmin also has said, that for equitable development and not to leave anyone behind. So this will demand, our attention to inequalities with multiple dimensions of the deprivations that you are talking about. So I'll be focusing more on the data aspect and what has been talked about as the evidence-based research or planning. See, data on its own, as we all know, I don't think I need to address that to this audience, that data on its own does not mean anything unless it is brought into a context. So in most of our outputs that you generate, you don't have that context. So what is now really talked about is, you can say that synonymous to metadata. So once the description of metadata is perfect, so then your comparability across states, across nations will also improve. So I mean, just aside to give you an the policy of the government is to improve our standings in various global indices that we are talking about, whether it is gender inequality index or your ease of doing business, etc., so that we look ourselves among the nations and try to improve our rankings. So to improve our rankings, one of the things that one observes is the lack of identical load by us, as well as the publishing agencies such as the HDI or the ease of doing business and other publishers. So although we may have an improvement in our indicators, but the same is not getting reflected in our international indices. So the reason is, for instance, I can give that in the case of labor force participation, for instance, the definition of unemployment followed by us and the ILO, there is slight difference. So with the result, what they do is they moderate our estimate, and then you get a different set of numbers, which is pulling down our ranking. A case point similar to that is the maternal mortality rate. There also we have had a very good improvement to 113 or so, but the HDI, which is HDRO, which takes that information, there it is shown around 130 or 140. So the ministries and the line departments now are engaging with the publishing agencies to improve their ranking, etc. So having said that, the importance of metadata I wanted to talk about at this stage, and SDGs in particular. So it's a universal accepted fact that data has always been the most critical role in efficient planning. And for the SDGs, which was adopted by the UNSD, in which 150 countries have been signatories of that, it has around 17 goals and 169 targets. And along to achieve those targets, you measure your progress by the help of indicators. These indicators, which the UNSD has prescribed there are around 247 indicators, but we have come out with a list of 302 indicators, of which around 250 we have some information, but the remaining we are trying to collect information on that. So for evidence-based planning, so this data that you are going to collect, like for instance, we are having a specific survey by the National Sample Survey Organization only to pick up some 25 indicators relating to the SDGs. That cuts across various aspects of social sector. You have relating to water, relating to internet usage, relating to nutrition, relating to poverty. So that is what I want to underline. Then we also have it's a platform where the data requirement is so high that not only depends on not only depends on because I am not able to see anything here on official statistics and administrative data, but also encourages to explore the use of big data generated data, geospatial and earth observation data, open data, etc. So SDG monitoring ecosystem can be strengthened by leveraging science, technology, data innovation platform. In this direction, to collaborate on issues relating to statistical monitoring on goals and targets, we have entered into an MOU with the UNRC as well, so that you get the best practices from various countries. You also get the best methodologies. Our methodologies are vetted. So in this manner, we are able to get more out of the memorandum of undertaking. Understanding. So the evidence-based data-driven policy formulation has a vital role in the inclusive development of the economy. So we have developed for the SDGs a national indicator framework, and with identified data sources and periodicity, taking into account the national priorities and needs. So this NIF will be used to monitor progress of SDGs in the country. And we have also created a dashboard for the same. So in the context of SDGs, to bridge data gaps and to increase significantly the availability of high quality, timely and reliable data disaggregated by income, gender, race, ethnicity, migratory status, disability. I mean, these are all the indicators we are talking about, and other characteristics relevant in national context. We have a dedicated survey. That is what I was describing just now, which is currently in the field. It will be over by the end of December. So from there you will get a lot of information remaining around 25 or 30 indicators we will be able to get. Now, coming to your conceptual framework of this report, I think we can also generate a few indicators from this conceptual framework, especially the health and survival area. So, and nutrition as well. We don't have information, I think, on breastfeeding. Probably that will be an interesting input into our SDGs. And some comments on the the report I could glance through is that the comparison, especially on the neonatal mortality rates, the comparison has been with the SDGs and your NFHS. NFHS relates to 2015-16, but neonatal mortality is also brought out by the RGI, where it is Now this is being compared from 29 vis-a-vis 12. I mean the target of 12 deaths per 1 lakh live births, 1,000 live births. So the reference point has now shifted from 29 to currently it is around 25. So we have to, in order to reach 12 deaths per 1,000 live births, so we have to figure out how to go about instead of 29. So when you are comparing this, you should compare with the NIF data. That is what I wanted to point out at this stage. I once again wish this report a success, and we also see that there are 44 indicators in the SDGs which now relate to the children and need focused monitoring. Thank you very much.
Thank you, Sri Murthy, for really bringing out the importance of data in evidence-based planning and achievement of SDGs. And also, I'm glad to know about this special NSSO round on SDGs, taking various indicators which have a bearing on the development of the entire country on various parameters. And also, I would like to thank you for pointing out this the data issue from NFHS. We will try to rectify it, the neonatal mortality data which you mentioned, and we will relate it with NIF. And we also would like to learn more from you on the various initiatives taken on SDGs, and we have a program with the BBSR in Germany where we are working on SDGs. So I think it will be great to connect with you on this. And now I would like to bring out the key findings of the report. The study is a result of teamwork. I would like to take this opportunity to thank UNICEF, especially Mr. Maiti, who has been with us since day one, and the research team at NIUA, Dr. Vishwajit Kaur, Mr. Rakesh Mishra, Dr. Tania Devnath, and Ms. Pragya Sharma, who has been really working on this project. And since the scope of the study was very extensive, I will not go into presenting the entire study, but speak on the key findings and policy recommendations. As you see, we have chapters on health and survival, nutrition, water, sanitation and hygiene facilities, education, employment and migration, crimes, and then we conclude with policy recommendations. We also have prepared policy briefs on various sectors. The first one is on nutrition, health and wash among children and adolescents. Next one on education. The third on child labor in India. And the fourth is on crimes. What are the challenges and how we need to address those. So what is new in this research? I think the research has tried to focus on urban at all possible levels of disaggregation, analyzed at the macro level the rural-urban differentials, looked at regional data, which is the state level, but we have looked at the UNICEF intervention states only and Delhi. And we looked at the city-level trends and patterns in the status of children and adolescents in terms of health, nutrition intake, wash, education, employment, violence and crime based on unit-level data from various sources. We have also tried to analyze the differential dynamics among poor and non-poor children and slum and non-slum, and examine the determining factors and associations. There were several limitations to this study. The first one was inadequate sample size at disaggregated level, absence of uniform data, again absence of standardized data. Each data source is based on a different time period with varying levels of disaggregation. So that was another limitation. Absence of city level data. We got data for only 8 cities from NFHS and 19 cities from the National Crime Bureau report. And as was pointed out by one of our speakers, the definitions keep changing over time. So standardization within the national definitions and international, that was another challenge. The levels of analysis were restricted to country, state, union territories, and urban poor and slums. We looked at urban poor, non-poor data, and we tried to work out by taking the first 2 wealth quintile for the NFHS, and for the NSS, we took the monthly per capita consumption expenditure, the urban one. There were various age groups which we have looked at. For education, we had a separate age group for each level of education. For health, we looked at 0 to 5, and for adolescents health, 15 to 19 years. The data sources were for health, we looked at NFHS data, specifically the 3rd and the 4th rounds. Education, we looked at UDICE, National Achievement Survey, again NFHS 3rd and 4th rounds, and NSSO. Employment, NSSO, PLFS, and census, the socioeconomic tables. For crime and violence, we looked at the NCRB data, National Crime Records Bureau data, as well as, because data was not exhaustive in that, we also went for content analysis of 5 leading English dailies across the country for the 365 days just preceding the initiation of this study. In health and survival, we looked at child mortality among various indicators. I think this is very important, child mortality and SDGs. As you all know, health, nutrition, and wash are highly interrelated phenomena, and inadequate access to water, sanitation, and hygiene compounded with child malnutrition, they form critical impediments to good health and well-being of children. Our panelists did point out that NNMR among urban poor, I think we need to work out this data once again, but as per whatever we have calculated, it is twice higher than the SDG target of 3.2. So what I wanted to say is that the current under 5 mortality rate among urban poor is almost double the SDG target of 25 per 1,000 live births. Considering the pace of decline in under 5 mortality rates in the past 1 decade, it is unlikely that we could achieve SDG 3.2, and in order for attaining that, I think concerted efforts need to be taken. Another important point is that urban poor in UP, Jharkhand and Chhattisgarh have 2.5 times higher under 5 mortality rate compared to the SDG target. These states also need to really act upon this area. When we look at IMR, we find that it has come down for all groups, but sharply for urban poor, which is also a good finding. And urban India has attained the target of IMR of 28 as per the National Health Policy 2017, which is also a very good finding. But the urban poor and slums are still lagging. There we need to work. And gender gap does persist in under 5 mortality among poor. And we find that male mortality is higher than that of females. When we look at this map, we find that under 5 mortality rate is concentrated in the states of Uttar Pradesh, Himachal, Madhya Pradesh, and also in the eastern states among the urban poor, and as well as the all urban. We tried to work out some pooled panel regression estimates to find out the effect of demographic, socioeconomic, and program factors on infant mortality rate and selected predictors. We have done this for several other areas also, but here I'm going to present only models 6 and 7, which have come out with a very interesting finding, which is social development of women has a positive impact. And we find that from the regression exercise, we find that increase in immunization mean age at marriage and mean years of. The 7th model, again, poverty, high higher fertility and bias in fertility behavior leads to higher infant deaths, but use of modern contraceptives reduces infant deaths. The analysis also shows that with 1 unit increase in the modern use of modern contraception, there would be a corresponding 0.27 unit decline in IMR. Again, for 1 unit increase in the level of females mean school of years of schooling, there would be a 4.8 unit decline in the level of IMR. Therefore, one could conclude that if our women folk are really, they go for education and other parameters of social developments are developed, that really has an impact, positive impact on the reduction of IMR. For nutrition, we found that when we look at the trend in the situation of malnutrition among children in India, we find with decline in child stunting and underweight is higher among urban poor compared to rural counterparts. Wasting has gone up among urban poor children while declined among the rural children, and the share of overweight marginally gone down for urban poor children, and that has been increased among rural children. So this is between NFH's third and fourth rounds, 2005-06 and 2015-16, which is the latest data available with us. One very important finding was with regard to overweight among adolescents in urban India. What we found is that obesity is high among poor adolescent girls living in slums and compared to boys. And it is again higher in slums. So the pockets which are inhabited by the lower income groups, there we find obesity is increasing, but it has been increasing for all geographical areas across the country. When we look at the association between diarrhea and child stunting, underweight, anemia, and infant deaths in urban India, we find that diarrhea has significant positive correlation with the indicators of malnutrition. And also the states with a higher prevalence of diarrhea report higher cases of stunted and stunted children. Therefore, reducing stunting and underweight among children, both of which are manifestations of malnutrition, can be possible pathways for reducing under 5 deaths among the urban poor. And we also find that every 5th child born in urban poor households report low birth rate. So this is an area of concern. However, exclusive breastfeeding has increased among urban poor and in slums. Although the shares are lower than all urban and rural households, I think rural households, if you look at various geographical regions, rural households, because the folk they are able to stay at home, their shares are higher compared to the other units of analysis. And access to skilled birth attendants during delivery is also high for all, including urban poor and rural households. And adolescent pregnancies in India has come down, and that has been sharper for urban poor women. When we look at the water, sanitation, and hygiene sectors, we find at the national level, only about 22% urban poor households had access to water in 2015-16. Even now, 4 in 5 rural households as well as urban poor households do not have access to piped water, and this is one area which the current government has taken an initiative since 2019, and the figures really show that this is a huge challenge before the government of India to attain full coverage through piped water under Jal Shakti mission's target, and the target for achievement is 2024, so we do not have much time. I think concerted efforts need to be taken by various levels of government to really reach this mission's target. And the coverage of basic drinking water, which has declined by 1.6%, I think one of the major reasons would be many households of late have been using bottled water, and new areas which were rural, erstwhile rural, have been transformed into census towns in large numbers. I think 2530 new census towns were included in the last census. So these areas are still to get access to basic drinking water. This explains why over the last just round there has been a slight decline in the basic drinking water facility. And We also find that the urban poor fare slightly better as compared to rural poor in the access to both basic and piped water, which is understandable because rural areas are yet to be connected in a proper manner. And 2 in every 5 households in India are deprived of basic hygiene practice. That is again an important area of intervention with the COVID situation. We find low menstrual hygiene practice among urban poor. The utilization of basic hand washing is again severely acute among urban poor households, and which is also lower than that of rural households. I think this is another area where just now, since basic hand washing is an important area of intervention to fight COVID, we really need to work in this area. We did try to look at various associations of among various indicators, and access to safely managed water. We find that it reduces diarrhea, malnutrition, and child anemia. So access to safely managed water through piped water would be provision of piped water would be one of the important areas of intervention. We tried also to create a correlation heat map for indicators of health, nutrition, and wash in urban India. I'll just quickly go through the main results. The greener, it's more closer to 1, it's positive, and the red with higher numbers, it's negative correlations. What we find is that child stunting and underweight are highly correlated with under 5 mortality. Access to safely managed water leads to least cases of child stunting and underweight, which again really highlights the importance of access to safe water. Malnutrition can be significantly reduced with reduction in waterborne diseases, which again shows the importance of water. And minimum dietary diversity is inversely related with indicators of child malnutrition and anemia. So the major policy recommendations coming out in these 3 sectors of health, nutrition, and wash is to increase budgetary provisions to strengthen on all actors. But public health with the recent pandemic, I think this is one area where the government really needs to work. Provision of granular data for making comprehensive assessment of programs and also for evidence-based planning. This is another area where we need to work. Promoting greater outreach of knowledge on hygiene practices among poor. This also assumes importance in light of the COVID. Behavioral changes need to come at household and individual level. We need to promote integrated efforts among various stakeholders involved in improving wash in the country. And small towns which could be statutory, and the new census towns, they need infrastructural investment, and this is more important for the wash sector. Now I come to the education part. Here what we have tried to look at is the attendance, and what we find is among urban children and adolescents, 12% did not attend school at all. And among the people who did not attend, among the children and adolescents, 3/4 were poor. Among the poor households, only 9% in the age group of 6 to 13 years did not attend school. This share rises to 52 for adolescents. So what we get from this study is that with increasing age, we find higher dropout or higher non-attendance in schools. Share of girls aged 6 to 17 years who have not attended school is lower than that of boys. Major reasons cited are failure and not interested in studies, costs, work, and marriage. And gap in age-specific attendance ratio between poor and non-poor is declining. And states of Madhya Pradesh, Rajasthan, UP, and Gujarat, they are highly deprived states with regard to education. And of all the non-attending school children, the share of poor is much higher. It's about 3/4. And learning poverty is a major concern, where even at the age of 10, children are unable to read or write. And only 49 and 40 students out of 100 students attend basic proficiency in language and mathematics at class 5. Girl students performed better than boys, while the performance have been equal among boys and girls in mathematics, but for language, I think girls performed better than boys. And the NCT of Delhi emerged as a capital of learning poverty, although we know that Delhi is an educational center, but when we look at the data on government schools, we find only 1/3 of students have attained basic proficiency level in language and mathematics at class 5. There are laggard states, Telangana, Orissa, UP in language, and Uttar Pradesh, Maharashtra, Tamil Nadu, and Chhattisgarh in mathematics. When we look at the age-specific attendance rate among urban children and adolescents, there are certain pockets basically which are not doing well. The southern states, the northern and the eastern are better off compared to the other parts of the country. When we look at age-appropriate completion rate, overage education is a major challenge. Only 55% urban poor children have been able to complete upper primary on completion of 14 years, and the figure reduces to 24 for higher secondary. So as one goes up the ladder, one finds that the attendance has come down as well as the completion rate. And household expenditure is around 40% one spends on private coaching. There is discrimination against girls in the allocation of household resources, which increases with level of education, and the ICT use is about 1/4 for poor households, which is an area of concern. So one really needs to shift the objective from universalization of enrollment to that of attendance. One needs to also extend the coverage of right to education from primary to secondary and higher secondary level. One also needs to deploy teachers according to the strengths of students, focus on digital infrastructure, develop standard operating protocol for online learning. And with the COVID, we all are aware how important this is. One also needs to restructure the curriculum to avoid long-term interruption in academic activities. I think globally there are 200 million students are out of school this year because of the pandemic. We also tried to look at employment. I'll briefly touch upon this. We do not have much time. We find that with age, the share of working and neither studying nor working increases. Also, in 2017-18, the PLFS data, as per that, we find 5.6 million children and adolescents were economically active, of whom 1.2 million were located in urban areas. Work participation rate of this group was 1.8%. 75% of working children and adolescents in urban areas were poor. And work participation rate among the poor and adolescents was 2 times higher than the non-poor. 90% in the informal sector, 55% of these child workers were working in the hazardous industries, and every second circular seasonal migrant was poor. Employment-related migration has come down between 2001 and 11 as per the census results. What we would like to say as policy recommendations is that major policy focus should be on young adolescents. Definition of hazardous work for adolescents need to be tightly streamlined. One needs to prevent hazardous work among the adolescents with strict monitoring. Also, elimination of all kinds of work among children with stricter implementation of National Child Labour Project. Tracing and mainstreaming know-where children is also important. Increasing social security, establishing procedures for accurate reporting of working and children and adolescents. Focus on rising unemployment and inactivity in the current COVID-19 period is also one of the important policy recommendations. And majority of these adolescents need social protection and skill enhancement. And they should also be covered under NCLP. We tried to look at crimes involving children and adolescents, where we found that girls are the major victims of different types of crime. And again, Delhi is the crime capital of children when we look at the crimes against children. Sensitization, conducting behavioral change, self-defense training, sensitization again among children is, and legal protection for them is very important. Lastly, I would like to stress upon data part. I think it has been talked about. Data availability at regular intervals, ensuring granularity is very important. Integration among various ministries and departments, concerted efforts by all stakeholders in meeting the SDG targets. And finally, a focus on peri-urban areas, census towns, and the invisible poor migrants and urban poor. I think they are the special focus areas of all types of intervention. Thank you very much. Now we have a short panel discussion. May I invite Professor James, Director, International Institute for Population Studies, Mumbai, to highlight his views. And I did not mention in the beginning that we had a team of experts across the country who helped us in peer reviewing each of our chapters, and Professor James was one of the experts. Sir, we would like to hear from you, your views on the report and on the specific areas of your expertise.
Okay, thank you. And let me congratulate all the team led by Debolina for actually bringing out this important report. I know the efforts behind it. I have only done a very small part in reviewing it, but the entire work behind this report, as well as the analysis which have been done for this report, I think it is commendable. So my compliments to the entire team, as well as for the UNICEF, as well NIUA, for taking up this task. Let me also thank you for inviting me to be a panelist, because that also gives you another opportunity to go through the report a little more carefully. So thank you for that opportunity. And then I would, because I know there are limitations of time, so I would limit my comments to maybe a few points, which is purely from a demographic perspective, because that's, I thought, it's better that I stick to areas where I have the expertise, so I would stick to that. I don't think that we need to emphasize the importance of this report, particularly the children and adolescents, in the context where, because they are the future of the nations, and we are looking to them actually for the future development of this country. So tomorrow's adults, as well as tomorrow's workforce, that is what we, our children, as well as the adolescent, we look forward. And it's also true that qualitatively they are really different, primarily because the children and adolescents are to be placed within the context of a family or within the context of a society or community. So naturally, the indicators you are bringing out is not really meant exclusive for that group. It is actually will tell you what is the real context of the community or the real context of the households or family within India. So that way, I think I also found that one of the beauty of your report is that many indicators you have brought out is primarily on the household indicators, which gives you really an understanding was which kind of household context and which kind of the societal context these children and adolescents are currently living. I think that is very, very important, either for the policy perspective or even really to see how one can really take forward the future agenda for these groups. And if you really look at the census data or what is really happening in children and adolescents, we also knew that this is the proportion, this is the group of population where actually the proportion of population is the overall population is declining. Or in other words, actually the total number of children and adolescents in India is on a decline. So 2011 census has clearly brought out that even the 0 to 6 population was on a negative growth, and even that's not 0 to 6, even beyond that. So that means that even at this point in time, even 0 to 19 population is on a declining. So what does it signify? It signifies two things for me. One is that the per capita expenditure, either the government spending for this group is now simply is higher because compared to the past, we have less number of children or less number of adults in that group. That is a real advantage. So virtually it should be much higher. The per capita should be much higher compared to the past. Although if you look at the household level, we know that the family size is declining. So the family, because of all these reasons, we can also assume that here by economic logic that the per capita expenditure the family is spending for the children as well as for the adolescents is much higher compared to the past. I think these two are the scenarios which we are the context. How do you really look at this report? I think that is what very, very important. As I told you, I will only just look at a few indicators, which is, I thought it is of my interest or my strength. So let us look at neonatal mortality, infant mortality, which gives you a rough idea what is really happening, because that gives you the entire context of the health systems in the countries. I think 2 or 3 things we can tell. One is definitely the urban poor is sort of similar to the rural areas or rural population, rural children, we can say. I think the narrow differences in the rate doesn't really signify anything. So basically it tells that urban poor is, the status of urban poor is similar to the urban, the rural population. But we also know that the overall urban, the rate is much, much better. What does it signify? It signifies that if you really compute for the urban rich or the urban non-poor, it means that, they have already achieved most of the SDG goals. That is what it signifies. It's also, in another way, it signifies the extreme diversity or extreme heterogeneity really persists in the urban areas of this country. That is, we don't need to take much importance to the slum area estimation, because there has inherent problems in the slum area estimation of the NFHS. Because NFHS was conducted in 2015-16, when it went to the urban areas, many of the slum areas which was census defined in 2011 was found to be either non-slum, or many areas which are non-slum in the past became slum. So because of that, it was impossible for the survey to redefine or define. So there has been some problem in the slum area estimation of the NFHS because of that. Because there has been substantial changes for the last 5 years. So what does it indicate? If you really look at then the data over a period of time, where is the decline? The urban poor decline is slightly higher than we can say the rural areas, but it is not really as good as the urban decline. If you really, I'm only looking at the neonatal mortality, which gives you what is the idea about what is the health systems in a particular area, because post-neonatal mortality can be declined because of various other reasons, but neonatal mortality tells you primarily about what is the importance of public health systems in the country. So it means that even with all these per capita increase in the per capita expenditure and all those things, sheerly because of the population decline, but even then we don't really see a drastic change in the rate of decline in the neonatal mortality, especially among the urban poor as compared to the urban decline. So it really tells you 2 or 3 points. I think that's quite important. Maybe I would conclude with those 2 points. One is that the urban poor situation is still, or even urban adolescent situation is relatively much worse than and extremely different from the urban non-poor, and the inequality persists in this setting is extremely large when compared to many other contexts. And if you look at really rural areas, you don't really see that much of a difference that we see in the urban context. So where should we intervene? That gives you an indication what is the intervention we need in the urban poor context. And it means that, even with a substantial per capita increase in per capita expenditure, which we would assume with a decline in the total number of children or decline in the total number of adults, we don't see a significant improvement as compared to the other sections. So that also means that although NRHM, etc., was there in the last 10 years between 2005 to 2015 in rural areas, the urban public health system is more to be desired compared to many other areas. So that is one point which we need to really see. And it also, second, it tells you that, you really need to enhance the expenditure further. Otherwise, it is really impossible to achieve what is expected to be the SDG target by 2030. That clearly gives an indication especially among the poor sections of the urban areas. So finally, what it indicates is that, unless there is a clear-cut institutional reforms in terms of the public health facilities or in terms of adolescent, if you really look at a simple data, and finally to end it, if you really look at the education data, that was a much striking data. Between 14 to 15 is only, between 6 to 13 years, only 8.7% was out of school. But if you just see 1 year again, 14 to 15, it becomes, in the urban poor, it is become 28.7%. So it is almost 3 times compared to 6 to 13. So that is where actually, which really shows that even with several interventions, we really not able to really curtail that stopping of the children's education, further enhancing the children's education or enhancing the health status of the children, where we need the intervention. I think this report that way gives you a very good indication where should we really invest in, where should we go further, as well as actually the excellent data it has produced gives you the vital inputs for the policymakers. I think all the best. I'm sure it will be a good guide for policymakers as well as for the researchers. Thank you.
Thank you, Professor James. There was some technical issue, sorry for that. I think you very nicely brought out the extreme heterogeneity in our cities, and that the non-slum, non-poor areas for most of the SDG indicators we have already achieved. So in one of, I think we could also do a small study on looking at how the poor and non-poor areas really work out, and things could be analyzed and adequate policy interventions could be taken in that light. Now I would like to invite Professor Ravi Srivastava, who was also one of our peer reviewers, for the floor and giving his key areas of whatever he feels like should be taken up in the areas of labor migration. We would like to hear from him.
Thank you, Professor Kundu. Like Professor James, you can hear me?
Yes, okay. We can.
Okay, thank you. Like Professor James, let me first join in congratulating you and your team. I've just glanced through the very comprehensive report, and of course your presentation has brought out many of the significant points. Actually, it's a very comprehensive study and has used, I think, a fair amount, almost all the secondary data which has been available. Mr. Murthy pointed out that there is some additional data which you could use, for example, to update the data on neonatal mortality and so on. And that will always be the case. There will always be some updating which will be possible even as the report is being printed. But it's very comprehensive. It brings out many of the dimensions of child deprivation. It also brings out most of the policy issues. I will focus mainly on the issue of child work, which is what you had, and migration. But also there will therefore be some overlap with the area of child education because of certain, the way you can actually identify child work and know where children. Let me begin by saying that your major conclusions, which you also highlighted in your presentation, points out the nature of the improvement that has taken place in terms of decline in child work, and also in terms of decline in nowhere children. But at the same time, it points to the stickiness of the problem in two very significant ways. First of all, child work, child labor has persisted in almost all dimensions. It has persisted not only in the household sphere, but also in the non-household sphere, not only in the informal sector, but also in the formal sector. And more than half the work that we see, more than half the child labor that we see is in hazardous industries, and that is literally the most serious dimension. In fact, actually, if you look at now, we have almost 35 years of experience of working with child labor, hoping to abolish child labor after the Child Labor Abolition Act. And what we have seen is that as there has been an attempt to reduce child labor, in the non-household sphere, this is very, very often pushed child work into the household sphere in different sorts of way. And we see this both in the non-agricultural sector, and we also see this in the agricultural sector. We also find that we see that, child labor being, that if there's a vigorous attempt to regulate or abolish child labor in one region, then you see the same the forms of production proliferating in other regions. And therefore, you see the difficulty in actually, eliminating child work. And this is both due to demand as well as supply factors. And this is what we see in different domains. Now, let me point out to you that the data that we have perhaps doesn't give us a handle on the clear magnitude of the problem. And I am absolutely, in concurrence with the report. The report has rightly pointed out that both the reporting of child work, the child work is normally underreported. It has also pointed out that the presence of children in school or child enrollment is also overreported. In fact, child education there's a vested interest I have found over the years in overreporting child enrollment, both by the school administrators and teachers and by households for various reasons. As a result of this, not only direct estimates of child work, but also estimates of nowhere children tend to be severe underestimates. Over the last several years, I've tried to use a very simple benchmark of estimating nowhere children. And I'll just put this across to the audience here for their reflection. If you look at the ASAR survey, for example, and I can go back to the UNICEF survey that we did some years ago, which was published in a book across 7 states, where I acquired these insights and then I used them repeatedly in different surveys and so on. If you look at the ASAR survey, what does it tell us? It tells us very few children, a very small percentage of children are not enrolled in schools. And this is what your result also brings out. But you look at the attendance rate which the ASAR survey also establishes. The actual attendance rates when the ASAR field staff goes to a school and verifies attendance against enrollment. And please look at the pattern of actual attendance. In states like UP, Bihar, West Bengal, the actual attendance rate is close to 55%. In states like Kerala and Tamil Nadu, the actual attendance rate is close to 90%. Now, if you assume that there would be a normal absenteeism of 5 to 10% due to illness and other reasons on any particular school day, then there are roughly 40%, more than 2/5 of the children in laggard states like UP and Bihar who are habitually absent from schools. And actually these, if you look at the definition in the Education for All documents and other things, these children should effectively be treated as having dropped out. And this then figures in the graduation rates, which Professor James discussed just before this. So these children are effectively nowhere children. And there is a very strong regional pattern to this very strong, very large incidence of nowhere children. The MVS Foundation, which has been working with the child labor issues for decades, suggests that nowhere children should be treated as child laborers. But even if we say that they are not all child laborers, the majority of them are involved in unpaid work or paid work, either in the localities where they live or through migrant labor. So I'm just saying that if you look at basically, if you interpret the data that we have, the incidence of nowhere children in the age groups that we are talking about, whether younger children or older children, is actually much, much higher than what enrollment figures tend to give us. And these children are largely involved in either unpaid work in the domestic sphere or different categories of work, either as helpers or actually as paid work. A large percentage of these children are involved as migrant child laborers. And this I've shown in my own publications, also through field work in number of areas. Children migrate out with their parents, children migrate out singly. And this actually brings me to the problem of migration. And let me just say a few things about migration, beginning with the fact that, and this is, I am sure that, the demographers here with us on the panel, and there are two of them, Professor James already spoken, and then we'll have Professor Bhagat. There is a great deal of fluidity between urban and rural settings for a whole variety of reasons. The urban setting now actually spills over into the rural areas, the rural peripheries. And the other very significant interlinkage between rural and urban settings is through migration, the migration of populations. And we have seen that basically it hit us in our faces during COVID, when we literally saw many tens of millions of people, men, women, and children walk back from urban areas into rural areas. Now, the urban migrant children, who are they? They comprise the homeless. They comprise children of destitute permanent migrants, the single child labor migrants, children accompany seasonal migrant families, children of poor long-term circular migrants, all of whom have a high propensity to be involved in economic activities or illegal activities or work which is illegal, including sex work. So, a lot of these children, the migrant children who are involved in such activities tend to be severely undercounted in urban areas. And certainly they are not counted in the kind of data sets which we use the urban household data sets that we normally use, whether the census or the NSS. So to that extent, the urban child work problem is severely underestimated or severely undercounted. So both these reasons that I have pointed out, the large magnitude of nowhere children and the fact that there is an undercounting of these child migrant laborers should alert us to the fact that we do not have, there are actually, we need to, the child workers that we look at are actually underestimates. So let me now quickly spend a minute each in two other issues and wind up. One is the whole question of impact of COVID. The report obviously has been written in a pre-COVID context, but COVID is now really the elephant in the room. And there are several aspects of this. First, as far as single migrant child workers are concerned, we have actually no information or whatsoever even now as to how they coped with the lockdown and the loss of jobs of earnings. Were they at some stage able to reunite with their families? How? If they stayed on, how did they survive? Did their employers support them through the crisis? Given the state of the economy now, what is their current status? I'd like to point out to this audience that Mr. Kailash Satyarthi is a Nobel Prize winner and has been involved with the child labor issue for such a long time. Actually, at one stage said that I want to make a plea. He said that he wanted to make a plea with the government to announce an amnesty for all employers who are using child labor, so as to give them an opportunity to reach out to them, to send the children, the migrant child laborers home, to be able to liberate them at that particular stage. So we know absolutely that. And this is a black hole in our knowledge, and let us admit it. Secondly, as far as children from poor families are concerned, the decline in family earnings and loss of access to free schooling is really a double whammy. And there is evidence that the poor children are being drawn into work, and in the case of girls who are obviously into additional unpaid labor, but there are also isolated reports of their being drawn into sex work to support their family. The government policies to support children through continuation of midday meals and continuation of education online cover only a tiny section of the children and really do not impact on the poorer children that we're talking about. They also impose considerable costs while being technologically unfeasible or difficult. So these are really areas, because this means that there is a very, as we all recognize, a huge increase in the nowhere children and children at work during the period of COVID. And COVID is not going to go away tomorrow. It's going to go with us. The impact is going to be with us now in the medium term. So our policies have to be designed to cope with these impacts in the medium term. Finally, on the policy framework, I'm happy that the report, talked at great length about the policy framework. I just want to, add one caveat, one additional issue. The report at this particular chapter, other chapters talk a great deal about policy and government policy. I'd like to bring in one additional set of institutions, which is extremely important and which their role needs to be assessed and they need to be strengthened, particularly in the context of child rights. And these are firstly, these institutions, for example, we have the NCPCR, which is an institution which was created exclusively out of the Convention of the Rights to Children. An assessment of how NCPCR has been able to function, what is needed to strengthen its function, because that is the institution centrally responsible for monitoring child rights in the country in all dimensions. Secondly, the other set of institutions are the important commissions. And I'm talking here about the National Human Rights Commission and the SC, ST, and the minority commissions in particular. So when we talk about child rights and we want to connect up with the SDGs, while it is important to talk about government policies, but I think these extremely important institutions which have a monitoring role and which can nudge governments from adopting a rights-based framework are also important, and there has to be an assessment of them, whether it happens within the framework of this report or somewhere else. Thank you very much.
Thank you, Professor Srivastava, for your important insights. I think that will really help in strengthening the interventions of UNICEF and the Government of India as well as the state governments. May I now call upon Professor R.B. Bhagat, who is the head Department of Migration and Urban Studies in IIPS Mumbai. Professor Bhagat, we do not have much time. I'm sorry for that. If you could really speak on your key observations on the report, and then we will take up Dr. Maithi's interventions. Thank you. You need to unmute yourself.
How many minutes you are
5
giving me? 5. So 5 to 6 minutes I will say whatever I have to say. So first of all, thank you very much for me. And this is a very comprehensive report. I could see 6 areas have been covered: health and child survival, then nutrition, water and sanitation, education, employment, crime. So very comprehensive coverage is there, and lots of data, particularly secondary data, have been used, and already co-panelists have pointed out the problem of the data. So this problem of data will continue. But this report will be very, very important in making policy and planning, and moreover, in understanding the urbanization process in the country. Whenever we are looking of urban policy planning,
Professor Bhagat, if you could close your video and just speak, I think that will improve the way.
Understanding the nature of. Is it audible? Okay. Is it audible? Audible?
Yes.
Hello?
Yes,
Hello.
It is audible.
So, okay. So, this report will be very helpful in understanding the nature of urbanization unfolding in the country. And that understanding is very, very important for formulating policies and programs. And when I talk about urbanization process, whether you talk about migration or do not talk about migration, migration will be always in such understanding of urban policies and programs. Actually, migration connects the area of origin and area of destination. And your report nicely brings out what is happening in the areas of origin. The states where the urbanization level is very, very low, particularly Bihar, where only 11% urban population, Assam only 14%, 17% in Odisha. So these states, I think, mostly located in central India, eastern India, and northeastern India, which are the source region having low level of urbanization. So these, and here you see in every indicator, whether we take health, child survival, education, anything you take, the indicators are very, very low. Even in urban area, if you compare urban areas of Bihar and urban areas of Maharashtra, disparity. So this, addressing this issue, regional disparity, and by addressing regional disparity, how we can provide healthcare facility or education or employment opportunity. It is really an issue of urbanization of this area. So urbanization may be a problem, but somewhere we have to think how urbanization can help and solving the problems also. And it can become the vehicle of rural development. So that is one point. The other point comes that when we are presenting the data for the cities, city specific. So in the city specific, it is quite clear that urban poor are worse compared with non-poor. Then immediately the question will be that is it because of migration, or can we prevent migrants are lurking in the minds, in the popular perceptions, or even in maker, and therefore migration, without addressing the question of migration, we cannot solve this. We cannot explain why there is urban poverty and how we can address this. The third point is that when we are talking about urbanization, then either we are talking about the big cities and the rural area, and in between we have large number of medium and small cities and towns which are missing. And these are the area which is extremely underfunded. There are programs like Amrit, but if you see the amount of funding for these large number of cities and towns in this country, we have 8,000 cities and towns in this country, but we are always talking about 53 million plus city or capital city, where I think 50%, around 50% of urban population resides. So this is, I think, a crucial question. We have to address urban hierarchy and the rural-urban linkages. So the final submission I would like to make that we are very good. We are very good in making our good policy and programs, but sometimes good policy and program doesn't work. Why it is not working? There are two important things, and that is the issue of urban inclusion. We have to address the issue of urban inclusion where there are processes are operating, and these two things are which can make our policy and program successful and effective if supported by planning and participation. We have virtually, I do not find planning as such. We have so many projects. So I think that there should be some bottom-up planning and comprehensive planning and participation of the people and people's involvement in participation. And I think the decentralized governance, 74th Amendment to the Constitution, which have been done long back, I think this can also be very effective strategy when we talk about data, along with policies and then the institutional framework. Because one of the problem always raised in our convergence, each aspect, each area, whether health or nutrition or employment or anything working in the silos, how there can be convergence unless there is an institutional framework, governance and planning. I think plan areas, a certain instrument where through which we can implement the convergence and we can bring about convergence. So I think we have to think in a broader perspective, and this report will be very, very helpful because it is summarizing a lot of data and putting in one place. My humble request will be to UNICEF bring out a report for the youth, because this is a report for the children and adolescents. There should be a report for youth, and also there should be a report for the elderly people, also urban elderly. So with these words, I think I will end my intervention. Thank you very much for this opportunity.
Thank you, Professor Bhagat. I think you very rightly pointed out the importance of planning and participation, the importance of the 74th Constitutional Amendment Act in bringing about decentralized governance, and also the policy focus that is needed in the small towns across the country. where there is large-scale deficits in urban infrastructure. May I now take this opportunity to invite Mr. K.D. Mehti, who is in charge of planning, monitoring and evaluation, a specialist at the UNICEF, to really highlight the key takeaways. And we do not have any time left for question and answers, and we have been responding to quite a few over the chat box. So,
okay.
What is yours?
Okay. Thank you, Professor Debolina. I know there is we are short of time. I think there are a lot of interest and a lot of things can be talked about on when it comes to urban planning. First of all, I would like to thank NIUA and the team of Professor Debolina Kundu and also other reviewers who have been associated with this work. Just to put in context, this work was conceptualized in October 2018, towards the end of it. And finally, when the work started, it was around the month of May or so when we started working on this project. This is how we began with to understand the trends and situations of urban poor and adolescent. We were aware of the multiple deprivation stories of the children living in the urban setup, and especially who are actually working in the poorer families, whether they are children or adolescent. At the same time, one of the other key objective was also to understand what kind of data gaps are there, which impedes in taking a very strong policy dialogue and a discussion, and also at the same time, are we faulting on the implementation of those policies that is existing? The three speakers that we listened, the panelists that we heard just now, they brought out the gist of the study very clearly. We heard that what was highlighted about the urban inequality, which is not about between urban and rural inequality, but within the urban areas, what has been the severity of inequality among the families living in the urban areas. We also heard what is important to enhance the expenditure and the need for institutional reforms. We also heard from Professor Srivastava very, very insightful gist of the report that we got it from NIUA, which is on employment, child labor and child work, and how the COVID situation has affected this dimension, especially the children. Professor Srivastava also highlighted something about, it's very, very painful and very hard to listen about what has happened to the single migrant children. Where have they gone and how are they coping on the current situation? Have they been able to meet with their families back at home? And also about nowhere children. We heard also from Professor Bhagat the need for a strong implementation of the 74th Amendment of the Constitution, and he justified the need for a bottom-up approach for planning and participation of the people in the entire planning process. Now, being a statistician, I thought I will also probably be not doing my justice if I don't touch upon some of the data-related issues. One data-related issues which have been highlighted in the report very consistently after each thematic chapter is about the challenges of the data. Now, whether it is the, when we talk about survival or health or nutrition related information, which we generally get it from the National Family Health Survey, the study also highlighted how it was difficult to really be granular in going and unpacking the situation of children and adolescents. What I was highlighting, there is a need for looking at the design of the surveys, whether it is National Sample Survey or the NFHS. When are they designing their survey, they have to keep in mind that we also need to understand about the situation of, say, urban poor, so that we have adequate samples to really analyze their situation. The other missing age group is about 5 to 14 years, which have been highlighted in the study. The CNNS study has picked up a part of this age group, 5 to 14 years. But ladies and gentlemen, this particular age group, 5 to 14 years, constitute a huge absolute number. So I was looking at the report which highlights that this the children and adolescents taken together constitute 492 million children. So if we are missing situation of such large number of children, that talks about inadequacy of our policy formulations, and also the advocacy and the schemes that are to be developed. Sometimes the advocacy becomes inadequate, or the strategy that we have planned to reach the last mile is probably not appropriate. I would also touch upon one interesting aspect, and which we with NIUA, we thought that it is important to come out with something very interesting, and that interesting part was a causality analysis, some of the causality analysis. One interesting causality analysis which have been brought out in the report is immunization and the nutritional status. The study says that there is a negative impact to the extent that 1 unit increase in immunization, that means full immunization, will actually bring down stunting by about 0.28 unit and underweight by about 0.18 unit in the number of underweight children. So there are many such interesting causality analysis that has been done based on the available data of the last 2 rounds of NFHS. I would urge upon the researchers and the policymaker to look at it and see how much we can use for our policy making. I would fail in my job if I also don't touch upon the area of social protection. Now, if we have to develop a solid, comprehensive and an integrated social protection program, where is the evidence for it? Now, if there is no evidence, whatever schemes or policies that we develop will probably be not very robust. So therefore, prioritization is required, that we need to highlight who are the vulnerable people. Do I have the situations of those vulnerable people? And collect adequate evidences for an integrated social policy protection for people who are living in the urban areas, who could be migrants, seasonal migrants, all kinds of people who are living in the poorer conditions. So I would end here. I wanted to speak a few things on education, but I think all of it are there in the report. I will urge all my participants to have a go at the report. I can tell you that these are interesting results, and it will be of immense use for you as a researcher, for you as a policymaker, to make the living of the poorest of poor, and as you say in SDG, taking the last person along with us when we move on the path of SDG. I think that will be successful. Thank you so much, and thank you, Professor Debolina, for all the support. Over to you.
Thank you. Thank you, Professor Maiti, again for the support that you have given to us from the day one. I think when we were conceptualizing this study in the later part of 2018, and then the last 1.5 years we have been working together. It has been a learning experience for me and my team. And I would like to take this opportunity to thank Director NIUA, Mr. Hitesh Vaidya, Joint Secretary and Mission Director at Smart Cities, Mr. Kunal Kumar, UNICEF Country Representative, Dr. Yasmin Ali Haq, Sri S.V. Ramanamurthy, Additional DG, Social Statistics Division from the Ministry of Statistics and Planning Implementation, for showing us the path for achieving sustainable development in the country. I would also like to thank our panelists, Professor James, Professor Ravi Srivastava, and Professor R.B. Bhagat, for their valuable insights just now, and also for guiding us in our while we were doing our report. I would also like to thank you, Mr. Maiti, for your guidance and support from the beginning of the project. Last but not the least, I would like to thank all the distinguished guests and participants who were with us this evening and made this event a success. I would also like to mention here that the report is there on at NIUA website, and UNICEF may also upload it as per their convenience. And we close this session now. Thank you all once again.